Good morning, everybody. My name is Elias Mumbaliu, and I have the honor to present Professor Bryony Beresford to give her presentation about parents and transition out of place or put in the wrong place. Professor Bryony Beresford is Director of the Social Policy Research Unit at the University of York. She's a social scientist with over 25 years experience, and her work includes policy evaluation of alternative models of service delivery, evaluation of specific intervention, and the lived experience. She has a lot of experience, and her talk is indeed about parents and transition, out of place or put in the wrong place. Bryony, you have the platform, please.
Thank you very much, and good morning. Thank you for this opportunity to present really what's been a sort of growing set of thinking really on the issue of transition. And when the EACD conference organisers approached me about doing a session on transition, I thought, well, this perhaps was an opportunity for me to reflect on my thinking, growing out of the research I've done on this topic area for going on 30 years. And I have chosen quite deliberately to look at the issue of parents and parents' place in transition. And what I'd like to do this morning is to reflect on where parents are typically placed in transition at the moment, reflecting on what that means when we look at the wider evidence around adolescence and young adulthood, and what implications might that have for the way we see parents in the transition process, and then thinking about going forward, what does that mean? I'm a career researcher, social scientist by discipline, and so my emphasis as I deliver this talk is also reflecting back on me and what should my research agenda be going forward? What research should I be seeking to pursue? Just very quickly to start with, quite useful perhaps just to take a moment or two just to think about definitions. Transition is a word we use a lot, and sometimes we'll have conversations and it becomes apparent we're actually talking about different things. So there's some words that typically come up when we're talking about transition in the context of children and young people. There's the notion of a transfer, that at a certain age, many children transfer from a paediatric children or children's service to an adult service. And that is that sort of almost the handing over of the case. And that's what we might consider to be a transfer. Transition is better understood as the whole process that surrounds that moment of transfer, from the sort of the work done to prepare a child for that transition and the work done in the adult setting. So it's a sort of notion of process. What we can't forget about is within the context of a service transition, the population we're talking about is also in a transition as a life stage for themselves, and that further complicates what we're thinking about here. But what I will be doing today is focusing particularly on healthcare transition, though I think it speaks to other sorts of service transitions that young people with long-term health conditions or disabilities encounter as they reach their late teenage years. So that's the sort of the definitions I'll be applying. So why, after all these years and having been in UK research and very aware of policy and developments over the years, why are we still needing to talk about transition? And I think the key thing is, and I think that's certainly our reflection in the UK and other countries, is it really still isn't working for young people. There's certainly little evidence of any substantive and embedded change in experience of the process. Poor outcomes in young adulthood continue to be reported, and that's particularly for some groups, children with neurodevelopmental conditions, children with very complex needs, And obviously one reason why it still isn't working is sometimes there is nothing to transfer to. There is no equivalent adult service, and that makes things even more complicated and difficult and unsatisfactory. And whilst there have been pockets of efforts to improve this transition, there's little evidence of systemic change in way services are organised and in delivery. So certainly we are starting to see in the UK a few services piloting all age provision for disabled children and young people that takes them from birth right through all through their life. But they're still unusual, but they are interesting to see. That is sort of regarded as perhaps one way of overcoming the problems we have with transition. I think we also have to remember that I think it's always going to be an issue because this is a dynamic population. The nature of the population is changing. We know that there are increasing numbers of older children, teenagers and young adults with increasingly complex needs. And that wasn't the case previously. So the population will constantly be changing. And it's also dynamic, and this is something I really want to sort of think about a bit this morning, is that evidence is always emerging on this particular group and life stage, out with applied health and care services research, but wider evidence from sociology, neurology and psychology. So we're understanding more and more about young people, young adults and families. And then therefore it's important that we would respond to it in terms of thinking about transition in a healthcare context. But it is rather puzzling. It still isn't working. Certainly, we know there's been lots of research on transition, and when I was preparing this presentation, I had a very quick and not academic and systematic Google search using some search terms in Google Scholar. And you can see the sort of the burgeoning and an almost explosion of research on transition in the sort of 90s and 2000s, perhaps a sort of levelling off. But you think, well, we've done enough studies on this, so surely we know enough to make sure that transition and transition outcomes are good for young people, but that clearly isn't yet the case. So there's certainly been plenty of research, but that hasn't necessarily affected any improvement. And certainly there's been a lot of policy at government, national level, policy within condition specialities, clinical guidance, and even certainly in the UK at least, quite considerable investment by government in improving transitions. And to some extent, that's become increasingly evidence-based in terms of what policies and guidance is drawn up, but obviously limited by the evidence available. So that it's in a sense, it is puzzling perhaps that why isn't transition still isn't working. So some possible explanations that I'm sure we've all mulled over in the past and are aware of. Certainly the context remains the same. Predominantly, we've got that model of separate child and adult healthcare. And I think we have an additional issue that when you're thinking about adult healthcare, disabled children are in a minority group. Children are always going to be, young people are always going to be a minority group in adult healthcare. So you've got disabled young people sitting in a minority group of young people within a context that is predominantly middle-aged, late middle-aged and older people. And so they are quite invisible when it comes to thinking about how can we improve healthcare for young adults. And I think another reason why it's very challenging to ensure positive outcomes for all children and young people into adulthood with different sorts of health conditions and disabilities is that, as I mentioned earlier, we are changing something at a time when there's multiple changes going on in a young person's life. And these life domains are not, are interlinked and interact with each other. And so you've got changes in their healthcare, in education, perhaps moving into the work setting or some sort of vocational aspirations. And then alongside that, there are developmental changes happening, and we'll come along a bit more to that later on, both at an individual level in the young person, but also developmental changes happening as a family. So it's very complex. So to get it right is therefore going to be challenging, but it's making sure we perhaps think about how we can do more to improve that situation. And I think another reason why perhaps we've still got this concern and issue around transition is that perhaps in the past, the diagnosis of where the problem lies has been too much at the sort of the paediatric end. So a lot of effort and attention has been paid to improving transition planning, understanding about transition readiness, think about what we can do to improve young people in terms of the self-management of their condition. Very little attention until recently has been paid to the destination of where they're going. And is that adult service right for them? Are they ready to provide care in the most appropriate and right way? And I think we've seen more recently a shift to looking across the whole process, not just at the children paediatric end of the continuum, and signs that adult services are recognising they have a role to play in supporting positive healthcare transitions. So those kind of all those different sort of explanations, the context, the complexity, and what was seen as the problem have really influenced the sort of research being done. So in the past, a lot of research on transition was about research when a child was in children's services. Very little attention paid to, so what are adult services like? What's it like to be in adult services as a young adult? And I think the other problem for research in the past has been we have been slow to shift from simply describing the problem to doing studies, doing research, which helps us to identify solutions. And that's been something that research has taken time to move towards. So there's minimal evidence still on what interventions can you do that are effective and support positive transition outcomes, and even less evidence around cost effectiveness of those sorts of interventions and ways of working. And a third reason, I think, is, and perhaps what has perpetuated many of those earlier explanations, is the place, role and function assigned to parents in transition. Both the way that parents have been conceived and placed by healthcare professionals and policy, and indeed by the research community. And I think it's fair to say that as individuals and collectively, our views about the place of parents has been influenced by personal beliefs and attitudes and normative developmental theories, including the more recent work on our emerging adult, which, whilst incredibly useful and helpful as a sort of step forward in our understanding, still is predominantly informed by research with typically developing children. So thinking where that's kind of led and why we're at where we're at, this question to me, well, are parents out of place or being put in the wrong place in transition in terms of how we conceive them, where they're placed clinically and in the practice setting, but also by research? So what typically is expected in terms of the place of parents during the transition process is they move from a sort of active and kind of lead role and responsibility in terms of the management of the child's condition, and an encouragement to sort of step back, to be quite passive in terms of involvement, And you see that in terms of practices in clinics where you have teenage young adult clinics, where parents don't attend appointments or only attend part of the appointment, and the emphasis, the attention of the clinician shifts towards the young person. And indeed, if this is resisted either by parent and or young person, this is problematized, and particularly parents are problematized as something that isn't right. Parents shouldn't still be wanting to be involved. And what happens is that in the work that health services and clinical teams do to support the young person to self-manage more, parents are excluded from that process. They're not involved in that process that clinicians are trying to work through with young people. And when we reach into adult healthcare, there is an ambivalence about parents being present in adult healthcare settings, and an uncertainty about what their role is and should be. So in a sense, overall, there's a sense that parents are sort of being sort of pushed out the picture. It is a way of conceiving it. But in a sort of slightly contradictory way, we have the situation where parents, for some young people, will and are remaining heavily involved in their lives because of the complexity of their care needs and the lack of adequate provision by the state to meet those needs. So there's a sort of slightly contradictory sort of rhetoric going on, really, in terms of policy for this group. So given that, that sort of high-level analysis, or my high-level analysis of this situation, just want to spend a bit of time thinking about, well, let's put that aside and let's see what wider evidence from sociology, epidemiology, neurology, neuropsychology, tell us about the place of parents in children's lives. And in a sense, this research doesn't problematize the place of parents. It just says, where are they? And what that tells us is that parents play a significant role in the lives of young adults. They are a key source of decision-making, emotional and instrumental support. By instrumental support, we could mean like information, practical support, financial support. And certainly that, what's observed in epidemiological studies, grounded in sort of sociological approaches, is supported by theory emerging since the 2000s about this notion of emerging adulthood, that in the late teens into the 20s, maybe the late 20s, there is a sort of another developmental stage not previously recognized, in which perhaps the highest level cognitive skills are still being developed and embedded. And people of that age are not autonomous individuals, and indeed don't want to be. We know from research that young people, young adults, don't regard themselves, haven't taken on entirely that adult identity, and that's an ongoing process. So we've got that sort of picture of young adulthood and parents still being important parts of their children's lives at that stage. And then we do know that it declines in later years as that young person and young adult gets older. And obviously we are talking about here in terms of sort of just a general, what's the general trend and picture. And so what you see happening is that parents are replaced by long-term partnerships and also by stable new networks having been established, having lost perhaps those peer networks that young people had in school and college. There is hopefully some degree of financial independence, which supports and causes that decline. And for some, there might be the issue of geographical distance and moving away. So all those things contribute to a sort of decline in parental involvement once we get past young adulthood. But at the same time, evidence shows that the nature and trajectory of the parent-child or the parent-adult-child relationship is complex, and lots of different factors will affect what happens in terms of the amount of contact, the strength of emotional ties, and the degree to which young adults and adult children go back to their parents for emotional and instrumental support. And there's research that shows that the nature of the relationship between parent and children in childhood predicts what it's like in adulthood. Certainly spatial proximity, living in the same house, living in the same town, or living further away, will affect what happens going forward into adult children's adulthood. Gender affects it. Other socio-demographic factors such as race haven't seemed to be so predictive of what happens to these parent-adult-child relationships. And then there are things that can happen, like life events that might draw families, adult children and their parents back together again. And certainly we know about parental health issues. And also family size will affect, or has been found to affect, the sort of trajectory of those parent-adult-child relationships. So it's clearly very complex and lots of reasons for individual difference in the parent, young adult-child and adult-child relationship and how they use each other. Now, layered on top of that, we've got the potential impacts of a health condition. So for young people, their abilities and capacities to assume and begin to take on autonomy and abilities to self-manage may be compromised by the fact that they have had fewer opportunities to develop life skills than children without chronic health conditions. Their peer support networks might be different and less dense and supportive than other young people. Their own developmental trajectory, skills and abilities may not be following a typical trajectory, and therefore that will affect how and what is the nature of the relationship they may have with their parent as they move into adulthood. For parents, and we're thinking about the emotional connection with their children, they have during their child's childhood assumed without question additional care responsibilities that have been imposed on them, but they have gladly assumed. And they've also encountered, which parents of children without chronic health conditions, an awareness of the fragility of their child's life potentially, and that's particularly so for children living with life-threatening conditions. And because there's been this diagnosis of a health condition in childhood, they have together been on a shared journey with it. That is not possible to sort of transfer and share it retrospectively with relationships established in adolescence going forward. So again, lots of reasons why the place of parents and the role of parents in the lives of teenagers and young adults might vary enormously between families. So given that sort of wider evidence around what is parents' place, what do we observe when we look out there, aside from leaving healthcare transitions aside? So what if we take this evidence back into and use this as a lens to look at what's happening in transition? I think that evidence is a sort of challenge to our perhaps individual attitudes and beliefs about the place of parents in adolescence and young adulthood. I think it flags the fact that these multiple causes of individual difference in parent young adult child relationships, parent teenager relationships, clearly signals that one size does not all when you're thinking about transition. And I think it also means we should ask some new questions. Might it actually be beneficial to actively seek to include parents in the sort of the work that a clinician is doing while to support a young person in learning self-management skills rather than exclude. Perhaps they should be included. Perhaps they could be a partner in this endeavour that health professionals are having in terms of supporting self-management. Is it actually beneficial to actually seek to remove them quite deliberately from this partnership, this therapeutic partnership that has previously existed, parent, child, and clinician? So I think asking those questions has implications for policy, practice, and research, and I'll briefly think about those now. But before I do, apologies, I have one more reflection, is that I'll just go back to those questions again. In a sense, I've got to the point in this presentation of raising these questions about the place of parents and challenging where parents currently are placed in transition by policy, practice, and research. So what is interesting to see is in very recent years, there are signs of change in the rhetoric about parents that's coming out of research. So we've got a study done in the UK, a big national longitudinal study of transition and transition outcomes, which looked at what factors predict positive outcomes in early adulthood, both in terms of health and wider transition outcomes. And it found the sort of the parental involvement, termed appropriate parental involvement. So that's not parental disinvolvement, but actually appropriate levels of parental involvement actually predict more positive outcomes. So that's kind of recasting parents in a more positive light, certainly. There's been a large systematic review which, in its conclusions about the parents and transition, it describes parents as key facilitators. So there's an acknowledgement that perhaps of something clinically and anecdotally we know has been going on. But perhaps most strong in their position is the work that Kerr has done, both in Ireland and Canada, which has tried to develop a sort of theory, a program theory to understand about transition and transition outcomes. And in the work she's done, and they've done as a team, with all the sort of relevant stakeholders to sort of develop a theory about improving transition, they make the statement about parents should be empowered to provide tailored support. So I hope you can see there's a real change here, an emerging change in rhetoric about parents' place in transition. They're now being talked about as having a role, as being key facilitators, and that they should be empowered to support this process. So what does this mean? For me, my reflections on this are that tells me we need to relook at the research agenda, refocus it, turn our attention to further theory development and work with clinical teams around developing interventions that empower parents to support their young people, and then to robustly evaluate the impact of that assigning parents that very different role. I think we need to perhaps revisit the notion of person-centered care and see how we can integrate a developmental perspective into that, a family-centered perspective perhaps. That makes more sense when we're looking at transition. And I think probably there's some work to do around education and training, challenging our own individual beliefs and attitudes about parents' place in the lives of their adolescent and young adult children. So I've certainly found it helpful putting my thoughts down and speaking to you about them. I hope you have, and is a stimulant for thought and future discussion. Thank you.
Thank you very much, Professor Bryony Beresford. This was a really excellent talk. This is open for Q&A, so for questions and of course answer coming from you. So let's have a look at the Q&A part. So till now I see no questions right now. Okay, let's start with a question from myself. Bryony, being in the academies, so EACD, Australasian Academy, American Academy, we're all searching for the place of families with family forums to bring their voice into our academy. But based on your expertise, what is the place of parents? Of course, we know the place of parents in children's life, and also during that transition. What is the place of parents in an academy? Should we focus more on parents or more on children who are at that time already young adults or adults? So how do you see that?
I think I think both have a place, and I think it's very challenging, isn't it, to facilitate and enable real participation of stakeholder groups, young people and parents in organisations, especially international organisations. And I think we probably have to learn to do it differently, and perhaps to take a more dynamic approach, not requiring necessarily long-term commitment to being on a panel or something like that, but actually trying alternative ways where there is more fluidity in terms of consultation and a more transitory involvement by some, and that should not preclude involvement. I think this whole pandemic has opened us up to the power of remote consultation, and how that can enormously enlarge the sort of groups you can consult with and involve in discussions and decision making, which simply wasn't possible in the past. I'm thinking particularly about families and young people where they have health conditions, disabilities. The virtual approach to consultation removes so many barriers, which feels very important. There are some really nice models of thinking about parental involvement. There are some really nice models of commitments by research groups to putting parents very much in the centre of their endeavours. At the University of Exeter, they have a faculty of parents that sits within their childhood neurodisability research group that is properly funded and has been in existence for 10 years. And that drives and informs the work they do and how they share their work. So there probably are good places to go to learn from in terms of improving and changing the way we might think about doing things.
Mm-hmm. Mm-hmm. Okay. Thank you. I'm looking at the questions on the screen. There, this moment, no questions right now. Perhaps it's also the moment to present Magda Krocek. She's the co-chair. Magda, do you have a question for Bryony?
Hello, good morning, Bryony. Very and great. Thank you for great lecture. And now in our country, in Poland, we established a new organization here named PANDA. It is Polish Academy of Childhood Disability, and in this our Polish Academy of Childhood Disability, we have not only professionals but also the families and people which take care of children and also adults from some kinds of disability. So thank you for your lecture, because it's inspire us to we know now how could this transition looks like, yes, during your opinion and in your experience. So it is also very good. It is very helpful for us also. So thank you very much, because our organization is new. We established there in this year in February, so we start now, and your lecture give us a lot of things which we can use in our organization. So thank you very much.
Thank you.
Okay, Bryony, meanwhile we have some questions in the Q&A part.
Yes.
So let's have a look. So where do you see the direction of future research? A general question.
Yes, I think future research should be theory based and look to further consolidate the theory work that Kerr and the team have done around understanding the factors and which influence transition outcomes, the sort of the active agents in that process, and where are the points of intervention to improve those outcomes. Now, where they have very clearly settled is that one area of intervention is about empowering parents to support that process. And so I would say that certainly should be a sort of going forward in research, that should be an area of attention. You know, how can clinicians and parents work together to support the self-management, the child to assume sort of responsibility for managing their condition. That seems to be an area where there isn't much research to date, and I think we will need strong evidence in order to effect changes in policy and clinical guideline. Quite rightly, they need evidence base to sort of, certainly in the UK, would represent quite a sort of shift in how things are regarded at the moment.
That's the key, and often the challenge, isn't it?
Yeah.
Yep. Yeah. A second question is, what if there's an awareness study on transition in Europe and the guide created for awareness, and what do you think?
Sorry, I didn't quite catch that question. Could you just say the question again?
What if there is an awareness study on transition in Europe and a guide created for awareness? So what if there's an awareness study on transition and a guide created for awareness to make it?
So I wonder if that person is asking about, is there some work to do around public perception of adolescence and young adulthood and the expectations that are placed on them, and perhaps in professional spheres that doesn't really align with what's happening out there in families in everyday life. I think that would be useful, certainly useful to know and understand more about sort of professionals' opinions and beliefs, if we need to do some work around sort of shifting of attitudes. Yeah. Okay.
Good. And then another question, and a final question here right now is, what is the place of the family? Care is centered on the needs of the child, who is the priority, but what about the specific needs of the family itself, and also talking about brothers and sisters, for example?
I think that's a really good point, and I think it raises that issue of, in a sense, in making the argument that parents shouldn't be sort of regarded as having a sort of redundant role in their children's lives in sort of the teenage years and into young adulthood, but regarding it as a sort of development, their role and their relationships, there's a developmental calls to them, but that requires us to have an understanding of or take a sort of family-centered approach to research and policy and practice from really the beginning, isn't it? So I think and a recognition of the care that families do on a daily basis, I think is very important, and for that to be overtly recognised more routinely, I think would make is important. When we've done studies with parents, they say no one ever asks me how I am, and so that recognition of their role by services, I think we certainly could improve, and I think that would, in a sense, helps with that relationship building and that sense of a partnership between the family and the clinical team.
Excellent. Thanks a lot. It was an excellent presentation.
Thank you.
Very good answers. And we have a lot of work to do, of course, and there are definitely, you talked about evidence-based aspects, and again, collaboration is key. And I think that's also the thing that we should find, not only over countries, but also over academies. So definitely this is a message that we also want to bring here. Thank you very much, Bryony Beresford, and see you over the coming presentations, or over the coming conference.